Welcome back in tonight's Rebound Colorado series. As we've reported, cases of COVID-19 are increasing across the nation. And here in southern Colorado, public health officials are working to track the virus. But as News 5's Patrick Nelson shows us, people are ignoring the contact tracing calls because they're worried about scams.
Public health officials admit there's still a lot they don't know about COVID-19. Reaching out to people who have been exposed or impacted by the virus is one way they hope to learn more. It's called contact tracing. But robocalls and scam calls are making this process more difficult for everyone. When our phone rings with no caller ID or even a phone number we don't recognize, many of us will ignore it, avoiding fraudsters and scammers. But right now, some of these unexpected calls are important. Often contact tracing calls are being ignored. These calls are designed to provide public health officials like epidemiologist Haley Zachary with important information to track the impact and spread of COVID-19.
There is a timeliness component to what we do. The quicker we're able to identify contacts, the quicker we're able to get that message out for prevention.
Dr. Fraud, CSU Global's J. Michael Skiba, warns scammers will try to impersonate public health officials.
They come across as coming from a local county health department, which they can easily Google some names and some phone numbers. So to the average person, it looks like a legitimate call coming in. The person actually sounds legitimate.
That's why it's important to understand what a legitimate contact tracing call will sound like.
We'll often ask for the course of your illness, medical history, and then also kind of locations and people you've been around for 2 weeks prior to about 10 days after your illness.
Scam calls are making contact tracing more difficult. Public health officials want to make it clear they will not pressure you, and you can always hang up to verify the call. Slowing down and verifying that call will keep you safe.
It's okay. A lot of times people feel like, I think, if they have a doctor or someone from the Department of Health on the phone, that they don't want to question who they're talking to. They might feel maybe slightly embarrassed by it or something, but it's okay to do that.
Here's your Rebound rundown. Expect a contact tracing call if you've tested positive or possibly been exposed to COVID-19. Public health officials want you to verify their call is legitimate. Health officials will only ask you questions related to tracking COVID-19. Never give up sensitive personal information like a social security number or financial information on a contact tracing call. If they ask for it, it's likely a scam. You can always verify that these calls are legitimate by taking down the number and contacting your local health department. Always watching out for you. Patrick Nelson, News 5.